We hear a lot about prenatal care, but postpartum care is just as important. And Amy Ranke, a certified nurse midwife with Women's Care Florida, joins us to explain more. Welcome back. How are you?
Thank you. Happy to be here.
I think Amy's becoming one of my favorite guests because I really do love all of our chats together. You always educate so much on things that maybe you've heard myths of. And this is one. Why is there so much focus on actually birth when we need to start thinking about that postpartum a little bit more?
Right, 100%. In our practice, we really think that honestly postpartum care is just as important as prenatal care, and I even think a little bit more important. So
okay, I got to ask why.
Yeah.
Why is that?
Yeah. So, because we're not just looking at you physically. Yes, we're dealing with mom and baby, but there's this whole other emotional aspect to it once you transition into motherhood that we as midwives really like to walk alongside of you.
Well, you and I have joked too, when you leave the hospital with a new baby, there is no instruction manual,
yes,
as we've all learned. But how long do you stay in the hospital? I remember being like, I don't want to leave. I don't want to leave. And
right.
It seems kind of quick.
It is quick, I guess. But yeah, so for normal vaginal delivery, you're going to stay 1 to 2 nights, depending on what your comfort level is. And, we kind of assess that with you. It's always a joint decision. And then if you do end up in a cesarean, then you'll stay 2 to 3 nights. So it just kind of depends. But yeah, and then we see you back in our office for if your baby is born via cesarean, then we see you at 1 week, which is a really good check-in, just like emotionally, honestly, but it is just to look at that incision, make sure everything looks good. And then we see you at 6 weeks. And then for a vaginal delivery, we don't need to see you till 6 weeks, but the really nice part about our postpartum care is that we are available to you that full 6 weeks, and then honestly even beyond.
I even remember like my pediatrician asking like, how are you doing? Because I think sometimes
awesome.
You don't necessarily think about what the mom is going through. All the focus is those pediatric appointments that are following the birth, right?
Yeah, that's so true. I'm happy to hear that your pediatrician asked you, honestly. Yeah, but yeah, I think 2 of the main things that as midwives we really like to focus on is lactation. So we are happy to see you back in our office, honestly, anytime those first 6 weeks, and then even after. And then also, yes, asking about are you experiencing postpartum blues or depression? So we know that those blue feelings can last for 2 weeks, and that can be normal. I tell people really in their 3rd trimester, like about 80% of moms are going to feel that way. You're going to be crying 1 minute, laughing the next, and that's normal. Really incorporating the partner into that. I love when the partners come because we can kind of educate both of you guys on that and what to look for. But then if those feelings are lasting longer than 2 weeks, that does transition into postpartum depression, which 1 in 7 of us are going to experience. So it is a really big topic that we like to talk about to normalize it, because I think people are really hesitant to say that they're struggling.
You brought up during that answer talking about lactation and the help that sometimes is required. I know that's really one of the areas that you stand apart from everybody, because you do help with that. Maybe one mom thinks they've got it down, and then it's like, oh wait, this is a problem I didn't see coming. How important is that you're able to offer that service and continue past the hospital?
I think it's awesome. I mean, I saw one mom this week already. It's only Thursday, or twice already this week, and that's fine and great. And she was earlier on in her postpartum journey, and then we see people once their milk is established and all that. And I actually did see a mom this week, just kind of talking to her about going back to work and what pumping looks like. I think that can be a really important meeting as well, to talk about like, hey, what does this look like? What do you need to do? That kind of thing. So, and then in that meeting, we can also kind of check in about your emotions, because we all know everything goes hand in hand.
Yeah.
So.
Well, I'm so glad that you're able to explore these. What do people need to know if they're thinking about going and maybe contacting you or working with a midwife and they don't know the resources that they may have?
Yeah, I mean, if you're one of our patients, you can always contact us, really even past that 6-week mark. But there's tons of local resources for you depending on what you're looking for. So whether you're just looking for like a mom group who have babies around the same age, or a lactation group, or a group focusing on that postpartum depression, there really are so many resources out there. So contacting our front office, they can put you through to a provider, and we can just tell you like where to look for that.
Well, I don't know about you, but if I was in that boat, Amy, I'd want you on my side. Thank you so much. If you want to see if Amy can possibly help you or any of the wonderful team at Women's Care Florida, well, there's the website you see on your screen. Looking forward to chatting with you soon.
Yeah.